Strategies for Incorporating Rubrics in Assessment of QSEN Competencies. As schools across the country work to integrate the QSEN competencies and requisite knowledge, skills, and attitudes into their courses and curricula, questions are now arising about how best to evaluate the extent to which students have achieved them. This module explores the ways rubrics can be used to better evaluate students' achievement of QSEN competencies. In this module, you will learn practical strategies you can use to evaluate students' achievement of the QSEN competencies and to provide both teacher and students with performance measures. Before we go further, we invite you to pause the presentation and take a few minutes to look at these questions. On the top of a sheet of paper, write down what the word evaluation means to you. In other words, what does it mean to you to evaluate students' competencies? Next, look at these questions. List 4 to 5 of the strategies you currently use to evaluate students' achievement of the QSEN competencies, and 1 to 2 areas you would like to explore that are not currently in your evaluation repertoire. Rubrics are tools that can make evaluation more transparent to the instructor and student. They guide learning by defining criteria and setting benchmarks for performance. Rubrics allow students to reflect on their learning, highlighting their strengths, weaknesses, and learning needs. For instructors, rubrics allow for more objective evaluation. Rubrics also facilitate grading and guide the refinement of instructional strategies. Rubrics are tools for instructors and students that define expectations for learning and performance. They provide feedback on both student learning and performance, as well as the effectiveness of instruction. There are 4 components of a rubric. The task description is the assignment, for example, a paper, observation, simulation, or formative assessment. The scale outlines levels of performance. The dimensions of the assignment are the components of the task that are being evaluated, and the descriptions of the dimensions are your levels of mastery. To begin, consider what you want to evaluate. What are the critical components of the course or activity that students must achieve? Obviously, it is impossible for teachers to evaluate every aspect of performance, so giving serious thought to what aspects are most critical is an important first step. Identifying critical aspects also help focus both teachers' and students' attention on these features and make clear the course assignment expectations. Identifying the most critical aspects of learning and performance is difficult. Stevens and Levi suggest beginning this process by first reflecting on your goals for the course, listing the objectives for the assignment, grouping and labeling these into categories, and then applying scales. Let's look at each of these aspects in more detail. There are several important questions to consider before you develop your rubric. Answering these questions will help you construct your rubric. Think about the learning objectives that you want your learners to develop in the assignment. Go back to your reflection on exemplary performance. What specifically does it look like to you, and how can you communicate that to your learner? Some teachers have found it really helpful to actually complete the assignment. This will help you understand the nature of the assignment, the amount of time it takes, the clarity of the directions, and so forth, and will provide you with an example of exemplary performance. Obviously, care must be taken to adapt your expectations to the level of the student, but your experience completing the assignment can provide you with important information to refine it and the expected performance measure. As you reflect on the QSEN competencies, what KSAs are you evaluating? Within a particular assessment, will you include only the KSAs, or also your students' reflections, attitudes and values, or problem-solving skills? The dimensions of your assessment are endless, as your assessments evolve over time. The scale that you choose for your rubric has endless possibilities to express your evaluation goals and to help you and your students distinguish between different levels of achievement. In some cases, you are able to make very fine distinctions, so a 5-point scale is helpful. At other times, you are looking for aspects of performance that are either present or not. For instance, students must check the patient's arm rate prior to administering medication. They either do or they don't. In these cases, a dichotomous scale, satisfactory or unsatisfactory, is useful. Let's look at another example. Kathy Lassiter, a QSEN consultant and faculty member at Oregon Health Sciences University, developed a holistic rubric specifically for evaluating students' development of clinical judgment with simulation learning. This rubric was designed to be employed across programs to provide continuity of instruction and to reflect development over time. It has been used in many schools of nursing across the country. This rubric contains 4 tasks, a 4-point scale, as well as dimensions of the assignment and performance levels. You can also construct rubrics for evaluating students' participation. For instance, suppose you are teaching an online course in which students are asked to discuss pertinent quality issues. To evaluate their participation, you want to devise a rubric to evaluate this via students' written contributions to the discussion board. These dimensions and descriptions clearly delineate expectations for your students and give you a basis for evaluating and grading participation. Now let's look specifically at the QSEN competencies. Using one of the rubrics discussed previously, think about how you might evaluate the above questions related to the QSEN Patient-Centered Care KSAs. This type of content could be evaluated in a wide variety of rubrics. You could choose one question for a reflective journaling assignment with a one-on-one coaching session, or evaluate them during a debriefing of a simulation activity. If your student is presenting a case study, you might consider how clearly they present their case. The possibilities are endless. Use this example outline to begin customizing criteria for communicating your expectations to students. How would you describe exemplary performance by students working to examine common barriers to the active involvement of patients? Imagine what you might see that would tell you that a student was still developing this ability. Describe these differences to begin delineating the categories of performance. This is really difficult work, and constructing and critically examining the criteria with colleagues can help you continue to refine your rubric. You might find it helpful to also review the rubric presented by Amy Barton and Gail Armstrong in Module 12, Integrating QSEN into the Advanced Nursing Curriculum. There are also a variety of rubrics available within the Teaching Strategies section of the QSEN website. You are free to use or adapt any of these as you continue to develop your rubric. A clear, well-thought-out rubric has advantages for both instructors and students. Timely and detailed feedback encourages and enables students to evaluate their own performance on an ongoing basis and to think more critically over time. The uniform communication encourages dialogue between instructors and students and creates common expectations. Instructor reflection on students' performance after completing their students' rubrics helps them to improve their teaching by noticing those areas that were consistently difficult for students. Another important aspect of rubrics is that they can be a living document. They are presented at the same time as the initial assignment, and they can be used in a variety of ways in the learning environment. As you move ahead with designing your rubric, remember to start with the end in mind by determining the knowledge, skills, or attitude you expect your students to demonstrate or develop by completing the assignment or by the end of your course. There are 3 modules in this series that present ways the QSEN competencies can be leveled into beginning, intermediate, and advanced courses. You may find these modules helpful in determining the KSAs you want to introduce or reinforce in different courses. Be sure to review your course goals or learning outcomes to determine how and where evaluating these specific aspects best fits into the context of your assignment or course. Identify specific course concepts, processes, or procedures that allow your students to demonstrate their knowledge, skill, or attitudes in a manner that is meaningful in the context of nursing practice. Develop measurable learning objectives that focus on students' attention on these aspects. Design learning activities that will assist students in learning to apply, analyze, evaluate, and create. Last, create assessment measures in alignment with learning objectives and instructional activities.